The respiratory system's job is pretty amazing, bringing oxygen in and sending carbon dioxide out, like a constant exchange between the body and the world. This chapter walks us through how that system works and what can go wrong, from everyday issues like a cold to serious ones like pneumonia or COPD. Breathing is both automatic and emotional. When we're stressed, breath gets short and shallow. When we're calm, it naturally deepens. As massage therapists, our own breathing sets the tone for every session. So let's continue on into this chapter. The respiratory system begins at the nose and mouth, where air is warmed, filtered, and moistened, and travels through the pharynx, larynx, trachea, and bronchi before reaching the bronchioles and alveoli. The mucous membranes and cilia, as the cleaning crew of the respiratory system, sweeps away debris and pathogens to keep the lungs clear. The lungs are divided, 2 lobes on the left, 3 on the right. Each lung contains smaller units called lobules. Because of this segmented design, infections often stay localized instead of spreading instantly throughout the lung. The pleurae are thin membranes that connect the lungs to the walls of the thoracic cavity. They allow smooth, frictionless movement as the lungs expand and contract. The respiratory cycle happens about 12 to 20 times per minute automatically, yet consciously, breathing can be a tool for calm and control. Every breath we take is the result of muscle movement and pressure changes. The lungs themselves don't pull air in, they're more like soft, flexible balloons. It's the muscle around them that do the work. The diaphragm is the large muscle under the lungs. When it contracts, it flattens and pulls downward, creating space in the chest cavity. That space causes air to be drawn in. That's your inhale. The intercostal muscles between the ribs, they lift and expand the chest like the walls of a bellows. On exhale, everything relaxes and air flows out. Now, it's important to remember here that when the respiratory system is healthy, it takes 5% of resting effort to supply the whole body with adequate oxygen. Moving on to acute bronchitis, it is the classic chest cold, a short-term inflammation of the bronchial tubes, most often viral. It usually follows a cold or flu and tends to show up more in fall and winter. It's self-limiting and not the same as chronic bronchitis. You should expect a deep cough, chest tightness, low energy, then gradual resolution over a couple of weeks. Antibiotics usually don't help because it's viral. Time, rest, and fluids do. This condition usually begins as a cold or flu that spreads downward into the lower respiratory tract. The virus irritates and inflames the bronchial lining, causing swelling and excess mucus. That's what triggers the deep cough. While most cases are viral, other triggers like pollutants, allergens, or even reflux can create the same response. Fortunately, this irritation is temporary. Once the inflammation subsides, the airway returns to normal, and it's not the same as chronic bronchitis, which causes permanent structural changes. Now, how do we recognize it? The most common clues are persistent cough, mild fever, chest tightness, fatigue, sore ribs from coughing, and sometimes wheezing. Mucus may start clear and thicken or change color as the infection resolves. So think about how these symptoms affect breathing and overall energy. Clients may often feel weak or lightheaded after a week of coughing fits. Treatment focuses on comfort and patience, rest, fluids, and warm, humid air. Antibiotics rarely help because most cases are viral. Over-the-counter products, cough suppressants, bronchodilators, or NSAIDs may ease symptoms but do not shorten the illness. If it turns out to be bacterial like whooping cough, antibiotics can be prescribed. Supporting hydration, using humidifiers, and avoiding smoke or strong scents all make recovery faster. Acute bronchitis itself isn't dangerous for most healthy adults, but can become serious in people with asthma, COPD, or weak immune systems. The main risk is that it can progress to pneumonia if the infection deepens or the person doesn't rest. The benefit of recognizing it early is that clients can recover fully with no long-term damage if they allow for proper rest and hydration. Moving on to the most familiar of all, the common cold. It's a viral infection of the upper respiratory tract, also known as viral rhinitis or URTI. It's incredibly common, more than 66 million adult cases per year in the U.S. Adults average 2 or 3 colds a year, where children average 6 to 10. With over 200 possible viruses, immunity is short-lived, which is why colds keep coming back. Most people recover in a week or so with rest, fluids, and symptom relief. So what's actually happening in the body when we catch a cold? The virus first enters through the nose or throat, usually by droplets or hand contact, and attaches to the mucous membranes of the upper airway. The body immediately launches an immune response, increasing blood flow to the area and releasing histamines, which cause the familiar symptoms of congestion, sore throat, and runny nose. Basically, your body is trying to flush out the virus, so that mucus and that sneeze are actually signs that your system is doing its job. The incubation period is short, about 1 to 3 days, and that's when symptoms usually peak, around day 2 or 3. As the cold progresses, your immune system goes into high gear. The virus stays intact outside a host for several hours, spreading airborne, but more often via touch. Prevent spread of the common cold by frequent hand washing, avoid contact with infected people, and a healthy diet, sleep, and proper exercise. Colds are usually more annoying than dangerous, but can complicate to ear infection, laryngitis, acute bronchitis, and sinus infection. So let's list what we'd actually notice. A scratchy or sore throat, runny or stuffy nose, sneezing, mild cough, head pressure or sinus discomfort, fatigue or body aches, and occasionally a low-grade fever. Cold symptoms are mild and self-limiting, and if symptoms worsen after a week, it could indicate a secondary infection like sinusitis or bronchitis. There's no magic pill for a cold. It's all about comfort and care. Rest, hydration, and isolation are keys to recovery. Encourage the use of humidifiers, steam inhalation, and warm liquids to ease congestion. Over-the-counter medications like NSAIDs, decongestants, cough suppressants, or zinc lozenges may help manage symptoms, but don't shorten recovery time at all. Your body needs time, not treatment. What we can do is make that time a little more comfortable. Now, even something as simple as the common cold have a few things worth noting. While the common cold is usually harmless, it can aggravate other conditions, especially asthma, COPD, or sinus infections. For older adults or those with weakened immune systems, a cold can lead to more serious respiratory issues. Clients recovering from a cold may still feel tired or congested. Some may not be able to comfortably lie face down, so positioning becomes important. Semi-reclined or side lying can make breathing easier. Disinfect surfaces and wash hands often, since the virus can continue to shed after symptoms peak. Now we're moving on to something a little more serious, influenza or the flu. Influenza is a viral infection of the respiratory tract, similar to a cold but generally much stronger and faster hitting. It's often self-limiting in healthy people but can be dangerous for the very young, elderly, or immune compromised. Each year, 5 to 20% of the U.S. population gets the flu, leading roughly up to 56,000 deaths. So while most of us recover at home, it can absolutely become life-threatening for some. The flu virus enters the body through inhalation or contaminated surfaces that reach the mouth, nose, or eyes. It targets the mucus-producing cells in the respiratory tract, which cause inflammation and the classic soreness and congestion. The body's immune system response to that is fever, aches, fatigue, and it is what makes us feel so awful. The virus is shed during all stages: incubation, acute infection, and recovery, which is why flu season spreads so easily. That means people can pass it on before they even know they're sick. Let's look at the different types of flu viruses. There are 4 main types: A, B, C, and D. Type A causes most of the epidemics and mutates quickly, so we catch it more than once. Type B isn't as aggressive, but it can still cause serious illness. Type C causes mild symptoms and isn't linked to outbreaks. Type D affects cattle, not humans. The constant mutation, especially in type A, is why we need a new flu vaccine every year. Scientists monitor which strains are most active worldwide and design vaccines to match the predicted threats for that season. Next, we have different subtypes of the flu. Seasonal flu, which is the most common form, and it hits fall to early spring. Then we have H5N1, otherwise known as bird flu. It passes from wild water birds to domestic poultry. It is more rare form of domestic poultry to humans, and very rarely from human to human. There have been 620 deaths so far and a very high mortality rate. H1N1, or the swine flu, was a huge pandemic in 2009. It mostly appeared to target young adults, and it was extreme, sometimes fatal results. So how do you recognize the flu, and how is it different from a cold? Symptoms can range from mild to severe, and they often come on suddenly. The flu usually causes sore throat, dry cough, headache, chills and fever, aching muscles and joints, extreme tiredness or weakness. And if a client tells you it hit me out of nowhere, that's usually the flu. Colds sneak in and the flu slams the door wide open. Because of inflammation, breathing can feel heavy and energy drains fast. Recovery takes time even after the fever breaks. Sometimes the flu doesn't stop there. While most people recover fully, complications can develop, especially in people with weakened immune system or chronic illnesses. Possible complications include pneumonia, sinus infections, ear infections, and dehydration. In severe cases, the flu can even worsen heart or lung conditions. That's why you'll often hear doctors say, "Don't push it. The body needs time to heal after a virus like this." Treatment for the flu is mostly about rest and prevention of complications. Most people just need rest, fluids, and isolation to prevent spreading it. Over-the-counter medications can relieve fever and pain, but won't shorten the illness. There are antiviral drugs that can shorten the infection if started early, usually within the 48 hours of symptoms. Even though I myself am allergic to the flu shot because of the use of egg yolk in the vaccine, I still encourage the annual flu shot. It remains one of the best defenses, especially for anyone working closely with others like therapists. The risks include severe respiratory complications, hospitalization, and for some people, even death. Gentle massage in the recovery phase is wonderful for helping with sleep and energy recovery. The benefits of prevention and proper care are huge. Less time lost, fewer severe infections, and protection for vulnerable people around us. It's not just about avoiding the flu for yourself, it's about keeping the people around you healthy too. Good hand hygiene, sanitizing surfaces, and rescheduling sick clients are part of being a responsible professional. Remember that when you're positioning, long periods of lying prone can also cause issues. One of the most serious respiratory infections is pneumonia. It is an inflammation of the lungs caused by infection. The air sacs or the alveoli, fill with mucus, fluid, and debris, making it hard for oxygen to move into the bloodstream. It can range from mild to life-threatening depending on the person's health. Over 1 million hospitalizations and about 52,000 deaths occur each year in the U.S. due to pneumonia, most commonly in adults over 65. It is also the leading cause of death in children under 5 worldwide. Oxygen and carbon dioxide exchange happen in the alveoli, the tiny air sacs of the lungs. When these alveoli fill with mucus, dead pathogens, and white blood cells, that exchange becomes blocked. This means oxygen can't move into the bloodstream efficiently and carbon dioxide can't escape. Imagine trying to breathe through a sponge filled with water. That's what pneumonia feels like to the lungs. As the body fights the infection, the inflammation can cause capillary damage and small areas of bleeding, which leads sometimes to bloody sputum. Some terms worth mentioning here are pleurisy, that's when scar tissue develops between layers, and empyema, which is an infection of the pleural fluid. The cause of pneumonia can vary quite a bit. Viruses like influenza, RSV, or herpes can trigger it. Bacteria such as Streptococcus pneumoniae or Staphylococcus aureus are also common culprits. Mycoplasma, the smallest living infectious agent, causes walking pneumonia, which tends to be milder and responds to antibiotics. Fungal pneumonia is rare, but more common in people with compromised immune systems. So when we say pneumonia, we're really talking about the result, not just one specific bug. When the immune system wins, the body reabsorbs the infectious material in the damaged tissue, but there still may be long-term damage and scarring in the lungs. When the immune system doesn't win, it usually complicates to things like meningitis, sepsis, respiratory collapse, and it can be fatal. Pneumonia often develops as a secondary infection, a complication after another illness like the flu, heart disease, or stroke. Anything that limits movement, weakens breathing muscles, or suppresses the immune system increases the risk. People recovering from surgery or those who are bedridden are especially vulnerable. It's one of those conditions that often sneak in when the body is already tired. Vaccines for influenza and pneumococcus can help prevent many cases. There are different types of pneumonia. First, we'll talk about ones by location and then by source of infection. By location, there is bronchopneumonia, lobar pneumonia, and double pneumonia. By source of infection, we have community-acquired pneumonia, nosocomial pneumonia, and healthcare-associated pneumonia, along with aspiration pneumonia. First, we'll discuss by location. Bronchopneumonia begins in the bronchi and spreads into the lungs, patchy and scattered, not isolated. Lobar pneumonia affects just one lobe of a lung. Inflammation stays localized. Double pneumonia affects both lungs, making breathing especially difficult. We can also classify pneumonia by how the infection started. Some cases are community-acquired, which are picked up in daily life. Others are hospital-acquired, and still others are aspiration pneumonia, which is caused by inhaling food, liquid, or vomit into the lungs. Healthcare-associated pneumonia is also common in people who use ventilators or live in long-term care facilities. So the word pneumonia doesn't just tell us what's wrong, it helps doctors figure out where it came from and how best to treat it. Symptoms depend on how severe the infection is and which parts of the lungs are affected, but common signs include cough, often producing thick or colored mucus, chest pain that worsens when breathing or coughing, shortness of breath or rapid breathing, fatigue and weakness, fever, chills, and sweating. Sometimes confusion in older adults or people who are dehydrated. Pneumonia can come on gradually or suddenly, and breathing often sounds crackly or wet through a stethoscope. Treatment depends on the cause. Bacterial pneumonia is treated with antibiotics. Viral pneumonia requires rest, hydration, and sometimes antiviral medication. Mycoplasma infections respond to certain antibiotics. Fungal pneumonia may need antifungal therapy. Supportive care includes pain relievers, corticosteroids, and plenty of rest. Decongestants and cough suppressants are usually avoided because the body still needs to clear out the mucus. So for clients, recovery isn't just about getting over the infection, it's about rebuilding lung strength and stamina afterwards. Rigorous massage is never suggested for someone with pneumonia. In subacute stage, it may be helpful, but it is best to wait until someone has completely recovered. If the therapist is healthy and the client is past the contagious stage, gentle work can be supportive during recovery. Historically, percussion therapy was used to loosen mucus, but today it's been replaced by deep breathing, exercise, and mobility. Let's move up into the sinuses. Sinusitis is an inflammation of the nasal sinuses that can be either infectious or non-infectious. It's extremely common, with about 35 million cases per year in the U.S., leading to around 16 million doctor's visits. Sinusitis can be caused by viruses, bacteria, allergens, or environmental irritants like pollution and smoke. It can be acute, which is short-term, or chronic, lasting longer than 12 weeks. When sinuses clog, it's like pressure building up in those little caves inside your face. Uncomfortable, but usually treatable. The sinuses are air-filled cavities in the skull that help warm, moisten, and filter the air we breathe. When they become inflamed, usually from infection or allergies, the mucous membranes swell, and mucus can't drain properly. That trapped mucus creates the perfect environment for bacteria or viruses to multiply. It's like water sitting still in a puddle. When it can't flow, it stagnates and it causes many problems. As we mentioned earlier, we have two types of sinusitis, non-infectious and infectious sinusitis. Non-infectious, otherwise known as allergic rhinitis or hay fever, you have inflammation without infections. The nasal discharge is thin and runny, and you are at risk for a secondary infection. In infectious sinusitis, that is where a pathogenic invasion is happening. You are having an inflammatory response at the sinuses. It is a vicious circle where inflammation interferes with drainage and prolongs the infection. It also can be a complication of a cold or flu. The hallmark symptoms are facial pain or pressure, especially around the eyes, forehead, and cheeks, congestion and nasal blockage with thick nasal discharge, often yellow or green, reduced sense of smell and taste, post-nasal drip, causing coughing or sore throat. People may also feel fatigue, low-grade fever, or pain that worsens when they lean forward or lie down. If you've ever bent over with a sinus infection and felt that throb behind your eyes, that's the pressure we're talking about here. What helps when those sinuses are inflamed? Well, treatment depends on the cause. If it's viral, it usually clears on its own with rest fluids and warm steam. If it's bacterial, a doctor might prescribe antibiotics if the symptoms last more than 10 days or worsen after initially improving. Other helpful treatments include nasal saline rinses, decongestants, and corticosteroid sprays to reduce swelling. Allergy-related sinusitis may improve with antihistamines or allergy medication. And the simplest thing, staying hydrated, thins the mucus and helps everything drain properly. Surgery is only considered for chronic cases where there's structural blockage like a deviated septum or nasal polyps. Clients recovering from sinus infections may feel pressure in the face or head, and they might prefer to avoid lying flat. You can accommodate by keeping the head slightly elevated and using a lighter touch when around the face or temples. Gentle facial massage or lymphatic drainage techniques, when the client is no longer infectious, can help ease congestion and promote sinus drainage. A lot of clients say they can suddenly breathe again after a session like that. It's a small thing that makes a big difference. Next on our list is chronic bronchitis. It is a long-term version of the chest cold that we talked about earlier. Chronic bronchitis is part of the group of disorders known as COPD, or chronic obstructive pulmonary disease. Unlike acute bronchitis, which comes and goes, this one never completely clears. It is the third leading cause of death, with stats of chronic bronchitis and emphysema combined, affecting people mostly over the age of 65. In healthy breathing, we see inhalation, where muscles enlarge the thoracic cavity and air rushes in to fill the vacuum. In exhalation, we see where muscles relax and air eases out as lungs return to its original size and shape. In chronic bronchitis, airways always stay irritated and inflamed for months or even years. It's most often linked to smoking, but long-term exposure to dust, pollution, or workplace fumes, or even other irritants can also cause it. Think of the bronchial tubes as little pipes that are always swollen and coated in mucus. Air just can't move through easily. The constant inflammation leads to thickened bronchial walls, excess mucus production, and the classic chronic cough that lasts for at least 3 months a year over 2 consecutive years. Over time, that trapped mucus narrows the airways and makes the person more prone to infections. Clients with chronic bronchitis often describe feeling short of breath, even with mild activity, and their cough is most often noticeable in the morning. Again, factors include exposure to irritants, hyperreactivity of smooth muscles, especially for people with asthma. As the disease progresses, the bronchial lining cells change because of constant irritation. The normal cilia, those tiny hair-like cleaners, become damaged and stop clearing mucus effectively. The body responds by making more mucus to try to protect the lungs, but that just adds to the blockage. It's a bit like your body trying to put out a fire with buckets of water and then flooding the house instead. As oxygen exchange become less efficient, the heart and lungs have to work harder. Over the years, this can lead to pulmonary hypertension and right-sided heart strain. This is a progressive condition, meaning it develops slowly but can worsen if the irritant, like smoking, continues. Typical signs include a productive cough with thick sputum, especially in the morning, shortness of breath and wheezing, fatigue, and reduced exercise tolerance, bluish skin or lips, which is cyanosis, in advanced cases from low oxygen levels, frequent respiratory infections that take longer to recover from. First and foremost, if the client is a smoker, they will be advised to stop smoking. That's the number one step to slow or halt the progression. Doctors may prescribe bronchodilators to open the airways, steroids to reduce inflammation, and oxygen therapy in severe cases. Pulmonary rehabilitation, exercise, breath training, and education can also help improve endurance and quality of life. Even small changes like learning to breathe through pursed lips can help someone feel more in control of their breath. The risks include repeated infection, long-term lung damage, and heart strain if it's unmanaged. But the benefits of early intervention are real. Using prescribed inhalers and staying active can greatly slow disease progression. Once the airways stop being irritated, the lungs may not be perfect, but they can function better, and that can completely change someone's quality of life. Patience and compassion are essential when working with clients who live with chronic respiratory disease. Every breath is an effort, and kindness truly matters. Offer options to lying flat on the table, maybe semi-reclining or massage chair, address breathing muscles to improve efficiency and lessen fatigue. We have arrived at a serious but treatable condition, tuberculosis, often called TB. TB is caused by the bacterium Mycobacterium tuberculosis. It usually attacks the lungs, though it can spread to other parts of the body. It's important to note that there is a distinction. There's latent TB versus active TB, which we will discuss in the next few slides. Globally, TB remains a major health challenge. Millions of new cases each year and many lives affected. It is mostly among new immigrants, Asians, Native Hawaiians, Pacific Islanders, and African Americans. Homeless, those in long-term care facilities, and correctional facilities as well. It spreads when an infected person coughs, sneezes, or speaks. Airborne droplets carry the bacteria. What makes TB tricky is that you can carry it without feeling sick, and then under certain conditions, it becomes active and contagious. In the primary phase, Mycobacterium tuberculosis enters the lungs. The immune system tries to trap it by forming small clusters of immune cells called granulomas. If the immune system succeeds, the infection becomes latent TB, where no symptoms and not contagious. Moving into the secondary phase, if the immune system weakens, those bacteria break free, multiply, and destroy lung tissue, causing active TB. It's like the bacterium go into hiding, and years later, they can wake up when the body's defenses are down. Add that, TB can spread beyond the lungs to the kidneys, bones, or brain, which is called extrapulmonary TB. Risk factors for exposure are proximity to someone with active disease or living in close quarters. Risk factors for active disease is not completing TB treatment, immune suppression, or special connection to HIV. If a person is co-infected with TB and HIV, it raises the risk for an active TB infection. Note that a skin test for HIV may not be accurate. Drug-susceptible TB, which is the main focus of this discussion, is sensitive to antibiotics, and the prognosis is excellent with treatment. Multi-drug resistant TB, which is about 1% of U.S. cases, is a mutation resulting from an incomplete treatment. A person with an active form spreads this to others. Extensively drug-resistant TB is resistant to almost all antibiotics with poor prognosis. There's only been about 15 cases of this since 2009, and a person with active case can spread this to others. In the primary phase, it's often completely silent, where the client may have symptoms of flu. In the secondary phase, there's usually fever, sweating, weight loss, exhaustion, chest pain, shortness of breath, cough that produces bloody sputum, and symptoms of infection in other tissues. The good news is that TB is treatable, but it takes commitment. Treatment usually involves a combination of antibiotics for 6 to 12 months. Because the bacteria grow slowly and hide inside the cells, therapy must be consistent. Stopping early can cause drug-resistant TB, which is much harder to treat, so education and follow-up are everything. Skipping doses isn't just risky, it can make the bacteria stronger. TB is contagious if a person has an active infection, but usually it takes prolonged contact, but a massage is still contraindicated. Antibiotics may have side effects that impact massage, like joint pain, neuropathy. A person under treatment who is not contagious can receive massage therapy, barring problems with medications. Always remember to base choices off of what the client can handle, making sure to check with healthcare team professionals if side effects are problematic. Now let's move into another major condition of the lungs, emphysema, one of the two big components of COPD. Emphysema is a chronic progressive disease that destroys the wall of the alveoli. In conjunction with COPD, again, it is the third leading cause of death in the U.S., with over 15 million people in the U.S. affected. Although this is a repetitive slide, just again a reminder of what healthy breathing should look like. The fact that it is in here several times with several conditions absolutely means to make sure that you're looking at it to know. With emphysema, lungs lose elasticity. Air gets trapped inside and becomes hard to exhale fully. Irritants and genetics like alpha-1 antitrypsin deficiency can contribute. Emphysema is not reversible, but quitting smoking and following treatment can slow its progression and greatly improve the quality of life. The constant irritation from smoke or pollutants damages the walls of the alveoli, those tiny clusters where oxygen enters the blood. As these walls break down, the many small sacs merge into fewer larger ones. This reduces surface area and makes gas exchange much less efficient. There's lost surface area of the capillaries in the lungs and fewer alveoli. With fewer alveoli, it becomes harder to pump blood in and out, harder to move air in and out. It goes from 5% to 50% of resting effort. With hypoxia damaging alveolar walls, diffusion rate slows even more. Risk of right-sided heart failure and risk of pulmonary embolism are high. Leading cause is smoking and pollution exposure, and there's also a genetic contributor with an alpha-1 antitrypsin deficiency. Lists of common signs are shortness of breath, especially on exertion, a dry hacking cough, fatigue, a barrel-chested appearance, prolonged exhalation with pursed lip breathing, cyanosis in advanced stages, and clients often describe feeling like they can't get the air out, even though they're breathing rapidly. Over time, they may lose weight unintentionally because breathing itself becomes exhausting. Treatment focuses on slowing the damage and improving breathing efficiency. Stop smoking. This is the single most important step. Bronchodilators and inhaled steroids help open the airways. Oxygen therapy may be prescribed when oxygen levels drop too low. Pulmonary rehabilitation programs teach breathing techniques, exercise, and energy conservation. Clients with COPD may have cardiovascular problems. It may be difficult to lie flat, so keep in mind gentle massage will be appropriate and helpful for breathing and fatigue. If you're planning on a massage with an emphysema patient, plan on semi-reclining or chair massage. Possibly side lying might be comfortable with appropriate pillows, and work on breathing muscles that can reduce resistance, improve efficiency, and lessen fatigue. Asthma is a chronic inflammatory condition of the airways that causes them to narrow and swell in response to certain triggers. These triggers can include allergens, smoke, exercise, cold air, stress, or even strong fragrances. It affects around 25 million Americans, including both adults and children. It's characterized by episodes or attacks where breathing suddenly becomes difficult, but it's usually reversible with medication or rest. Bronchioles are typically sensitive to debris. With asthma, however, they are hypersensitive, and triggers lead to swelling, excessive mucus production, and difficulty breathing, especially exhaling. It's often seen with two other hypersensitivity conditions, which are eczema and allergic sinusitis, which is hay fever. Contributing factors are the hygiene hypothesis, where it is too much protection from immune system challenges, GERD, sensitivity to medications, and other occupational exposures. There are ratings of severity: mild to intermittent, mild persistent, moderate persistent, and severe persistent. Moving on to the types of asthma, there is bronchial asthma, which is a general label and it covers most subtypes where there's tight bronchioles, mucus, and wheezing. Allergic asthma, trigger is allergen, such as mold, dust mites, animal dander, and some foods. Occupational asthma, where the triggers are environmental, such as smoke, fumes, gases, and pollutants. Other types of asthma are exercise-induced asthma. This is what you would have with physical exertion. Silent asthma comes with no symptoms before a major episode. Cough variant asthma, which is the primary symptom is coughing. We also have medicine-induced asthma, and it happens especially with aspirin. Hormone-induced with pregnancy or menstruation, and nocturnal, which is with circadian rhythm. Asthma episodes involve dyspnea, wheezing, coughing, exhaling is harder than inhaling, symptoms of panic, and episodes are sporadic and can last minutes to days. Over time, structural changes accrue and you are at risk for chronic bronchitis or COPD. Respiratory tract infections can be dangerous, and O2 deprivation in pregnancy risks for complication. Asthma treatment focuses on keeping inflammation under control and responding fast during attacks. There are two main categories of medications: long-term control medication like inhaled corticosteroids that reduce inflammation and prevent attacks, and quick relief or rescue inhalers such as albuterol, which relax the airway muscles during a flare. Identifying and avoiding triggers is also crucial, for example, smoke, fragrances, or strong cleaning chemicals. Massage can be soothing here and help reduce anxiety and help function in breathing muscles to reduce resistance. But remember, the massage room environment may have asthma triggers, scents, candles, essential oils, detergent, fabric softener. All of those things can cause problems. So make sure that you are also using hypoallergenic lotions because this will help as well. Most research has been done with children, and it has helped to improve lung function compared to control groups. Parents were taught how to massage their children, and it greatly reduced anxiety. Now we're going to talk about something far more serious: laryngeal cancer, or cancer of the voice box. Laryngeal cancer most often develops in the mucous membranes of the larynx, which sit at the top of the trachea and houses the vocal cords. It's more common in men over 55, especially those with a history of smoking, heavy alcohol use, or chronic voice strain. In a healthy larynx, it is needed for speech, swallowing, protection of respiratory tract, and breath control. The larynx houses the supraglottis, the glottis, and the subglottis, and functions may be lost with laryngeal dysfunction. Various growths can occur here, such as polyps, nodules, and tumors. Cancerous tumors usually begin benign and squamous lining of glottis, and they spread to the tongue, neck, and cervical lymph nodes. Risk factors include use of tobacco, excessive alcohol, especially both together, age, gender, exposure to HPV, poor dental hygiene, low vitamin A, GERD, radiation at the neck, and exposure to some toxins. Signs and symptoms present with persistent hoarseness or voice change, sore throat that doesn't go away, difficulty swallowing or the feeling of something stuck in the throat, chronic cough or ear pain, and unexplained weight loss in later stages. Typical treatment approaches are surgery to remove part or all of the larynx, radiation therapy to kill cancer cells, chemotherapy for more advanced cancer. After surgery, some patients breathe through a stoma, which is a small opening in the neck, and may use a mechanical or esophageal speech device. Skilled massage can help reduce anxiety and depression and improve appetite and sleep, and it does add to the quality of life. Just remember not to massage on tumors or undiagnosed lesions. Remembering that some patients may have a stoma at the neck, so you will need to accommodate for this. And if this requires treatment for lymphedema, that you do need advanced training for this. Now, as we come to the end of this presentation, we will be going over one of the most well-known and devastating respiratory diseases, lung cancer. Lung cancer occurs when abnormal cells multiply uncontrollably in the tissues of the lungs. It's the leading cause of cancer death worldwide, responsible for more deaths than breast, prostate, and colon cancers combined. About 85 to 90% of cases are linked to smoking, but secondhand smoke, pollution, and workplace exposure to asbestos or radon gas also increase risk. The lungs have no pain receptors, so the disease can grow quietly for years, often without any symptoms until it's advanced. These abnormal cells form tumors that block airflow and invade nearby tissue. Over time, cancerous cells can spread or metastasize to the lymph nodes, bones, brain, and liver. Healthy lung tissue is like a sponge, soft, flexible, full of air pockets. When cancer grows, these spaces fill with solid mass and breathing becomes harder. Main risk factors include tobacco use, airborne toxins, radiation for breast cancer treatment, a history of COPD, tuberculosis, and pneumonia, exposure to secondhand side stream smoke, and genetic predisposition. One type of lung cancer is small cell lung cancer, otherwise known as oat cell carcinoma. It accounts for 15% of cases. It grows fast, spreads quickly, and rarely operable. Another type of lung cancer is non-small cell lung cancer. It accounts for about 85% of diagnoses. Several subtypes are classified by which cells are affected: squamous cell carcinoma, adenocarcinoma, large cell carcinoma, along with others. It often metastasizes before detection and often resistant to chemotherapy. It can be treated with surgery or radiation. Other types of lung malignancies are carcinoid tumors, adenoid cystic carcinoma, sarcomas, mesothelioma, which is in the pleurae and associated with asbestos exposure. The most common symptoms are a persistent cough that just doesn't go away, coughing up blood or rusty colored sputum, shortness of breath or wheezing, chest pain that worsens with deep breathing or coughing, hoarseness or voice changes, unexplained weight loss and fatigue, and many symptoms that appear only after the disease is advanced, which is why regular medical care and imaging are crucial for people with long-term exposure risks. Treatment depends on the type of cancer, its stage, and the person's overall health. Surgery to remove the tumor or a section of the lung, radiation therapy to destroy cancer cells, and chemotherapy to target fast-growing cells throughout the body, immunotherapy and targeted therapies that help the immune system recognize and fight cancer. It's a long road, but treatment is improving every year, and survival rates are rising because of early detection and advanced therapies. Massage therapy can be supportive during a difficult process, and it can help reduce stress, anxiety, insomnia, pain, and fatigue. But remember, clients with lung cancer are probably undergoing aggressive treatments, and massage therapy must be adapted to their capacity. And clients who are at the end of life may have fragile bones and major organ involvement, but massage therapy can still be very beneficial for these clients as well, just remembering to keep a nice, soft touch. As massage therapist, we have a responsibility to be knowledgeable about this condition if we are working with patients who have this condition. Advanced education is necessary to work with cancer patients, and especially those with lymphedema. So in closing, this chapter explored the respiratory system structure, function, and major disorders, from the simple cold to complex diseases like pneumonia, COPD, and cancer. The importance of early awareness, infection control, and client comfort. As future therapists, our work doesn't stop at the muscles. We support systems of the body, including the one that gives us life with every breath. Remember, a calm environment, mindful breathing, and compassion can help someone reconnect to their own rhythm, one breath at a time.